Okay, so the first part of this video, we are going to demonstrate how to properly hang an IV bag. So I would just first compare the medications on the patient's, with the patient's chart. I would clarify any inconsistencies if there were any. I would check the patient's allergies. I would make sure that the IV solution we are using and the piggyback are both compatible. I would make sure that the patient wasn't allergic to chlorhexidine or alcohol or any IV tape that we were using. I would also then check the expiration dates on the bags, which I already have my bags here. They're not expired, and the color of the IV solution, and there's no holes in the bags, there's no leaking around the bags, they're intact. Both of them are, and both the color and no leaking, and they're all not expired, so the bags are good. Okay, so I would then go ahead, after doing that, I would close the door to the room, which I have already done, and I would initiate hand hygiene, just using some alcohol. And I put on gloves before going into the patient's room. Okay. So I put on my gloves, and I have entered the patient's room. I'm going to go ahead and first introduce myself. Hi, I'm Victoria. I'm going to be your student nurse today. Today we are going to be giving you a piggyback solution with penicillin and with sodium chloride. Is that okay?
Yeah.
Okay. So I'm going to first verify the patient's name and date of birth using her identification band. So you're going to say your name and date of birth?
Megan Taylor Teaser 31304.
Perfect. And that matches with the patient's chart as well. I would then go ahead and ask, have you had any recent surgeries that would contraindicate giving you an IV?
No.
Do you have any limb restrictions?
No.
Is there an arm that you can't have an IV in?
No.
Are you allergic to chlorhexidine, alcohol, or any IV tape that you know of?
No.
Okay, perfect. So all of those match, so then we can proceed forward. Okay, so I would first go ahead and remove the IV solutions from their outer wrapper. And again, just as a double check, make sure that they're not expired. Make sure that there's no leaking, that the color is clear, and that everything looks good, and both of them do. I have already gone ahead and put on the patient's initials, the type of the medication being used, the date it was initiated, and the time for both of them. Okay, and I do already have all my equipment gathered at the bedside, just right over here. All right, so first, what I'm going to do is I'm going to go ahead and insert the tubing for the saline. So I'm going to have my patient be our IV pole today. So go ahead and hold that up for me. Thanks. And then I do have the long tubing or the primary tubing in sterile packaging. So I'm going to maintain sterile technique as I remove this tubing from the bag. Okay. So at the top of this would be the spike in normal tubing, and the end of the IV bag would have an insertion spot for the spike, and this would allow the fluid to flow through. So I'm going to go ahead. Just going to grab tape to help it stick to the bag. Okay. And I would remove the spike from the bag without touching the tip of the spike, because remember it has to maintain sterility. And I would go ahead and invert the IV bag, okay? And I would go ahead and stick that spike in. Sometimes you have to twist it to get it in, okay, until it's all the way in. And before I drop the bag, I would make sure that the roller clamp is clamped, because if not, the fluid could flow, either all over the patient, all over you, or all over the floor, which we don't want to have happen. Okay, so the roller clamp is closed, the spike has been inserted, and then you have your long tubing. Okay, So I would just go ahead and loosen the cap on the end of this just to allow the fluid to leak out. So what we're going to do is we are going to allow the fluid to flow through the line, and I would go ahead and unclamp it, and you're good. And I would let the fluid flow through. I might have to kind of mess with the tubing a little bit. There would be multiple ports in this tubing, and I want to make sure that the fluid gets through all of those ports and that there's no air bubbles either in those ports or anywhere in the tubing. I would then take the end of this and I would either stick it in a sink close to the patient, hold it in the sink, making sure it doesn't touch, the sink or anything, or place it in a basin to collect the fluid flowing through it. And then once it's good, there's no air bubbles, fluid has gone completely through, I would then clamp the roller clamp, and then I would just stick the cap back on that. And I would just take the end of the tubing and probably place it or set it back in its sterile packaging just so it stays out of the way and it's, not in a dirty place. So pretend that's in the sterile packaging. Okay. And then we're going to do the same thing, but with the piggyback penicillin. So again, hold it up there for me. Perfect. Okay, and then I'm going to take the secondary tubing out of the sterile packaging. Okay, maintaining sterility again. So again, this would be the spike on the end of it. Okay. And I would be careful not to touch the spike. I would remove the cap and I would invert the bag and I would go ahead and stick it in using a twisting motion. I would make sure that the roller clamp was again clamped so that way the fluid didn't flow everywhere. Okay, and then release that. So what I want to do next is I'm going to take alcohol. This way a little bit. I'm going to take alcohol and I'm just going to scrub the port on the secondary line, and then that is going to attach to the primary line. Okay, and then I am going to release the roller clamp on the piggyback or the secondary line to allow the sodium chloride to flow through into the piggyback. Well, I did forget a step. Before inserting the tubing for the penicillin, the piggyback, I'm going to go ahead and squeeze that drip chamber, allowing it to fill 1/2 to 2/3 full. That a little bit more. Okay, and then I would go ahead and scrub the hub and attach that to the secondary or the piggyback tubing. Okay, and I would utilize the roller clamp on the piggyback. I would unclamp it and then allow the fluid to flow through to the secondary, allowing that drip chamber to fill about 1/2 to 2/3 full. Okay, 1/2 to 2/3 full, and then again make sure there was no air bubbles or anything. And then I would, once that was good, I would unclamp completely on the secondary line, and I would control the drip rate with whatever it was indicated in the patient's MAR with the primary tubing. And then I would go ahead and allow the sodium chloride. I put that on a blue hanger because that would hang lower than the piggyback. Okay, and then I would go ahead and get ready to initiate my IV insertion.